Hi, today I'm going to discuss with you this risk places of COVID-19. And we know that the COVID-19 will be with us for some time, and the virus and human being will be coexisted. And it is hard for us to eradicate this virus from this earth. So this is a fact. So what is important for us now is that we need to know where is the virus. And this is chart is created by the Texas Medical Association to link this virus from low risk activities and places and to high risk places and activities. And the link was created out by these physicians from COVID-19 task force and also committees on infectious diseases. Apparently that all these people who participate on this link are professionals. So the court provides some good evidence, good guidance for us to follow. And what I should point out is that the lowest risk is open the mails. This is actually good news for most of us. We know I open mails every day. I think every family in the United States open mails every day. And I did some research that because I want to know how, if this virus, how long the virus can survive on this envelope. And so usually I get conclusions about usually few hours, 24 hours, and the virus can survive that. So the maximum time is 24 hours. So what we did is that we usually, when we go out to get our mails, we wear masks, we have gloves, and then we put the mails on sunshine if they have for 24 hours. And so next day we then open it. And after opening mails, we will also hand wash. So far, I don't hear any report and any people contact COVID-19 due to this open mail. So this is really good news. But that does not mean you don't practice some protection from this virus. As mentioned, the virus can stay on the envelope. You need to practice, have mask and wash hand, and to make sure you don't contact this virus. And other things are pretty good news also that most of us do. So I usually get food from restaurant, take out, and I pump gasoline in my car. And occasionally I do some jogging and camping in the wood. And every week we do grocery shopping. And so looks like all this major activity actually have a lower risk. This is really good news. So, and this shows that all this essential part of daily life and actually low risk. But that does not mean that we don't need to practice all this. Wear mask and have social distancing and wash hand after. Anytime you go out and reach home. And so pretty nice to see that all these essential activities actually have low risk. If we practice the protect method, and the risk we get is COVID-19 is low. And here we just have looked at the high risk places where you get COVID-19. And the top on the list is going to bar. And let's show the detailed procedure when you go to the bar. People go to bar, usually you need to drink. So I don't know how can you drink with mask on. So this is big problem. So if you go to a bar, First of all, I don't think you're going to wear a mask. It's so inconvenient. You have one drink and then have a mask and take a mask and drink again. And most people will not do things like this. And that is not. And also when you go bar is some kind of social activity. You're supposed to talk to people. It's hard to practice 6 feet apart. So you cannot practice social distancing. And so it's understandable. Go to bar is on the top of the list. And other things associated with to go to the bar is you go to the concert and you go to the sport activity and have a huge religious service activity. So in all these situations, and just like go to bar, but it is hard for people to wear masks, it's hard people to practice social distancing, practice 6 feet apart. And that's why they are on high risk list. And that's now we have the virus with us for more than 1 year now. We have so much experience. We know most things about this virus. So we know how this virus is transmitted. And if all of us practice what we know, I think we have a very good position. And it's important that we need to have a mask. We need to have social distancing. When we need to meet, we need to practice 6 feet apart. With this, I'm sure that we have great chance to prevent this virus infection. And this is a nice chart. It's very useful to me. So every time I go out, so usually I search on the internet to see how dangerous it is. So with this chart, so I have all the information I need. So when I go there, so I pay much more attention. I know the risk, so I know the virus, and that's really useful information. And in this video, in the description, I have the link for this chart. If you want to print out this chart for yourself, you just go to my description in the video. And I just wish everyone have a happy and healthy life. And that's all for today. And I wish to see you in my next video.